The prevalence of depression in individuals has increased significantly in recent years. However, knowledge of what depression is, causes of depression, and signs and symptoms associated with depression and how it is treated is not widely known by many. Have you ever experienced a time in your life in which you feel sad, unhappy, or miserable for long periods of time? Do you know someone who has felt sad, unhappy, or miserable for long periods of time? There is a possibility that you or a person you know may have been experiencing depression. My name is Adrienne Lewis, and today I'm going to inform you on what depression is, causes of depression, signs and symptoms associated with depression, and treatment. As a psychology major, I've spent many hours studying mental and mood disorders and the causes, prognoses, and treatments that are associated with the disorder. Depression is the most common and prevalent mental disorder seen in the United States. Because of this increase, it is important to inform members of society of the signs and symptoms related to depression, so that they may seek treatment for themselves or help someone else to seek treatment. In this speech, I will explain what depression is, the different types of depression, causes of depression, signs and symptoms associated with depression, and treatment. Let us start with an explanation of what depression is. Depression can be described as feeling sad, unhappy, or miserable. Most people feel this way at some time or another during their lifetime. However, to be diagnosed with depression, one must feel this way for weeks at a time, and the feelings of sadness or unhappiness must interfere with the person's daily life. A person must have a presence of at least 5 of the following symptoms: depressed mood, anhedonia, significant weight change, sleep disturbance, psychomotor changes, fatigue, and feelings of worthlessness, indecisiveness, and suicidal thoughts in order to be diagnosed with depression. The most critical symptoms in diagnosis are depressed mood and anhedonia. Anhedonia is the decreased capacity to experience pleasure, and it is considered a central feature according to the DSM. The DSM stands for the Diagnostic Statistical Manual of Mental Disorders. This is where I get a lot of my information from regarding such disorders, as well as books such as this. This is a book that is about psychology that is applied to modern life. It talks about the most modern updates on mental disorders, mood disorders, and anything related to that. The symptoms of depression must last for at least 2 weeks in order for a person to be diagnosed. In extreme cases, people diagnosed with depression may lose touch with reality and experience delusions and hallucinations. Now that you have a general knowledge of what depression is, let us discuss the different types of depression. Major depression is classified by a combination of symptoms that interfere with a person's ability to work, study, sleep, eat, and enjoy activities that were once enjoyable. Depressive episodes must last for at least 2 weeks to be considered major depression. And depression is considered a mood disorder. Dysthymia is a less severe type of depression, and it includes long-lasting chronic symptoms that interfere with a person's daily life but does not seriously disable them. People with dysthymia usually experience major depressive episodes at some point or another. Atypical depression includes non-typical symptoms such as positive mood reactions to some event, significant weight gain instead of weight loss, an increase in appetite, oversleeping, heavy or laden feelings in arms and legs, and long-standing patterns of sensitivity to interpersonal rejection. Postpartum depression is typically experienced by women usually within 4 weeks of giving birth to a child. Men can also suffer from postpartum depression, but it's not commonly seen. Seasonal disorder is also known as seasonal affective disorder, and it occurs at the same time every year. People with seasonal depression usually experience depressive episodes during the winter because it's cold and it's cloudy and rainy, which makes for a more depressing mood. To be diagnosed with seasonal depression, a person must have a history of at least 2 years of experiencing a depressive episode during one season of the year, and then overcoming the depressive episode when the season is over. Psychotic depression is not only classified as major depression, but is also classified as a mental disorder. If a person is diagnosed with psychotic depression, there is usually a presence of delusions and hallucinations, and the person has lost touch with reality. In other words, they have entered a state of psychosis. Bipolar depression, which is commonly known, is also referred to as manic depression or bipolar 1. It's characterized by the occurrence of one or more manic or mixed episodes. Moods alternate between periods of major depression and times of extreme elation or mania. Those with bipolar 2 disorder experience more severe episodes of major depression, but their episodes of mania are milder and known as hypomania. Now that we have a basic knowledge of the different types of depression, let us discuss signs and symptoms associated with depression. Signs and symptoms to look for are agitation, restlessness, irritability, difficulty concentrating, dramatic change in appetite, often with weight gain or weight loss, fatigue and lack of energy, feelings of hopelessness, feelings of worthlessness, self-hate and guilt, loss of interest in activities that were once enjoyable, trouble sleeping or sleeping too much, and thoughts of death or suicide. Now that we know what the signs and symptoms to look for when diagnosing depression, let us discuss causes of depression. The exact cause of depression isn't known. Many researchers believe it is caused by chemical changes in the brain. This could possibly be due to a problem with genes, which could explain why depression can be hereditary. However, anyone can develop depression. Researchers also believe depression can be triggered by certain stressful and traumatic events. Traumatic events include the death of someone close, a breakup, abuse, job loss, stressful family issues, etc. Alcohol and substance abuse can play a role in depression. Medical conditions such as underactive or overactive thyroid problems, cancer, or long-term pain can influence depressive episodes. Researchers have shown that those with depression have differences in their brain. Some may have a smaller hippocampus, which is in charge of storing memories. When the hippocampus is smaller, there are fewer serotonin receptors. Serotonin is a neurotransmitter involved in the regulation of mood and impulsive responses. Other things that can play a role in depression are certain medications such as steroids, sleeping problems, and any hormonal imbalances a person may have. Now that we have a better understanding of the potential causes of depression, let us discuss ways in which depression is treated. Treatment of depression usually includes medication or types of psychotherapy. Antidepressants work to normalize naturally occurring neurotransmitters in the brain, and the two main types of therapies that are commonly used are cognitive behavioral therapy and interpersonal therapy. Therapy can be long-term or short-term depending upon the patient and their needs. Once people undergo treatment for their depression, they tend to recover much more quickly than they would without treatment, and they also reduce their risk of relapse. Depression can change the way you see yourself, your life, and those around you. All forms of depression are serious disorders and should be treated immediately. If you or a person you know displays more than one of the symptoms previously discussed, they should make an appointment with a healthcare provider to seek a treatment plan that would best work for them. Depression can have serious consequences if left untreated.